Hello everyone, my name is Sofia and today I'm going to have an interview with Dr. Dipesh Batra, super specialist and MCH neurospine specialist. We are going to talk about epilepsy and seizure. Welcome, doctor.
Thank you.
So, could you tell us please what is epilepsy and seizure?
See, these both terms are used overlapping. For a common layman, you can call it as epilepsy or a seizure. But in scientific terms, seizure is a single episode of epilepsy. When the seizures are unprovoked and there are recurrent seizures, then we call it as epilepsy. Epilepsy is a very common problem which can occur in any kind of age group. It can be in a neonate who is a newborn, or it can occur in elderly, like if the patient's age is 60 or in their 80s. So you never know when you have epilepsy, and you will be quite shocked to know the many good players like in cricket or football, they are also patients of epilepsy.
And how long do seizures usually last?
See, seizure can last from like few seconds to few minutes to few hours. So it all depends upon the cause of the seizures and how prolonged the patient is having the problem, and is the patient is taking any treatment or not. So if a patient is getting treatment, they can decrease the frequency of their seizures and they can decrease the intensity of their seizures.
And what are the major types of it?
See, there are so many types, but for a layman, mainly the types are general epilepsy and the absent seizures. And when there is the partial seizure, which can be generalized, or there are complete or partial seizure. So it all depends on what type of area they involve the body. If they involve just the face, or they involve the whole body, or sometimes they involve the whole side, like one side arm and one side leg. So, and the patient is unconscious. The patient becomes unconscious, he can tongue bite during that episode, or there is frothing from the mouth and the patient can fall on the ground, then we term it as a generalized seizure. So otherwise there are so many forms of a seizure, but in general if the patient is unconscious and there is this abnormal jerky movement of an arm or a limb or the face, so we label it as a seizure.
So if I have a seizure, does it mean that I have epilepsy also?
See, as I told you already, a seizure is a single episode. Although epilepsy constitute recurrent seizures, so it does not mean if you have a single seizure that you are an epileptic. So we can't say that.
And what causes epilepsy?
See, when labeling a person as an epileptic, you can say it as organic causes when there is any underlying brain cause. Like in countries, like infections are very common, like in developing countries, like tuberculosis of brain, neurocysticercosis, that is called as brain worm, and any brain tumor, any brain abscess, the infectious causes, and there are few electrolytic abnormalities. But when we label the patient as epileptic, there is no cause. So that is the crunch here. In epilepsy, most of the time no cause is found. All the radiological investigation like MRI brain, CT scan brain, they are normal. So here the crux is the patient feels that he is totally normal because there is no such deformity in their brain, or there is no diagnosis. They have a report where it is written as it is normal. But in actual, they are having recurrent seizures. That's why we mostly label epilepsy as idiopathic.
And how can I prevent epilepsy?
See, in actual, you cannot prevent it. If you are labeled as an epileptic, if you are a patient, the only point here to note is you need to take your medicines, you need to follow the precautions, and you need to take the adjunct dietary treatments which can, decrease the intensity and the frequency of the seizure.
And how can epilepsy be diagnosed?
See, as I already told you, there are so many tests to diagnose epilepsy. The blood tests, then there are MRI and CT scans of the brain, and EEG is one test, and sleeping EEG and continuous EEG for like few days is another test. But sometimes no cause is found. Some EEG is normal, CT scan and MRI, as I already told you, are normal, but still we label the patient as epileptic because there are seizures.
And who can treat epilepsy?
Most of the time epilepsy is treated by neurologists, neuro and spine specialists, and medical specialists.
And what can I do to manage epilepsy?
See, if you are an epileptic, you need to get your prescription right, you need to follow the instructions, and you need to follow your medicines as per recommended by your physician.
Are there special concerns for women who have epilepsy?
Yeah. It's actually a very good question. So any woman who is pregnant and she is epileptic prior to that, so there are many drugs which can cause fetal abnormalities. So it is a take-home message for pregnant women or women who are in the childbearing age. They should be very cautious because soon they are pregnant, they should go to their doctor. They need to change their medicines because few anti-epileptic drugs are fetopathic. They can cause abnormality in fetus. And few kind of epilepsies are provoked by pregnancy because there are hormonal changes in pregnancy. So we need to be very cautious if we are epileptic and we are in our childbearing age. So we need to prescribe some few nutrients like folic acid. They have folic acid deficiency in pregnancy. So if we are taking few drugs, so we need to take folic acid as such with those drugs.
And can a person die from having epilepsy?
See, usually not, but yes, the person can die. See, if an epileptic is walking on the road and there is traffic, so if he has seizure, or sometimes we call it as a fit, so he may have an accident or she may have an accident. So sometimes we are driving bicycles, cars. So yes, if you have uncontrolled seizure, you should not drive and you should not walk alone. Once your seizure and epilepsy is controlled, like I already told, there are so many players who are having epilepsy, but yes, they are playing their games. So it is not killing as such, but yes, you need to take your medicine properly. That is the only catch point here.
Can you please suggest us herbal remedies for epilepsy?
Yes, I already told you there are few nutritional deficiencies in epileptic patients and more so ever in patients who are pregnant. Like folic acid is one of the common vitamin that is deficient, and yes, magnesium, vitamin B6, and there are few other herbal remedies which have a very good role and they can act as an adjunct to the common anti-epileptic drugs. So ACA has all these herbal medicines in their kit that is called as Allergy Ayurveda, which can help as an epileptic patient and can act as adjunct to the treatment.
And what is the duration of this treatment?
See, because these medicines are herbal, so it does not matter how long you want to take, as they can be an immunity booster as well and they can prevent from the oxidant injury to the brain.
So it doesn't have any side effects?
No, because they all are nutritional supplements. You are usually taking in their food and people are taking for lifelong all the vitamins and the nutritional supplements. But yes, there are few catchy nutritional supplements which can help the epileptic patients in actual, and they should be taking good diet. They should follow a good sleep pattern, and yes, they can always take some adjunct treatment which can decrease the intensity, frequency of their treatment and duration.
Thank you so much, doctor, for joining us today and giving us so much information about the topic epilepsy. We know how much herbal treatments can help us out. If you would like to receive the treatment, you can order it from our website or contact at the below mentioned number.